Hey, she drove all the way from Owensboro to be here at the Nut Club Fall Festival. I offered her like a pre-taping thing, and she said, I have lunch plans. It says Merritt Bates Thomas.
I would not miss it.
Of course, but how do you decide?
Well, very carefully.
Right. There's so
I came
much.
with a plan.
Is it already blown out of the water?
No. No.
I'll be fascinated.
Very carefully.
All right, because you would, because you're trying to keep us all healthy, keep
Doing
our
my
type 2
best.
diabetes under control. But today we're talking about something else, a very important topic for women everywhere, and that's the annual mammogram.
Yes. October is Breast Cancer Awareness Month. Doesn't mean you have to get your mammogram in October. It just is a month to create awareness. So risk factors, first and foremost, being a woman, although it can affect men.
It can.
Something you and I don't like to talk about or say, but as we age, the risk increases. And if you have a family history, although that doesn't always come into play either, there are women affected every day who have no record of a family history. So it's very important that we be aware personally, have this discussion with our physicians around our history, but that first screening mammogram at the age of 40, but also being breast aware and doing breast self-exams, but paying attention and noticing any changes that you may see. It could be through self-exam that you notice a lump, and that's a monthly breast self-exam, or sometimes, as WEHT recommends, Shelley Kirk, twice a month, but set those days on your calendar and do that exam.
And simple, isn't it?
The mammogram is once a year. The other thing to be mindful of, and what many women face, is they hear their tissue is dense. So make sure you're getting the highest quality mammogram or screening that your insurance will cover.
Now, how do you know?
Well, if you get back a report that says you have dense breast tissue, what they do is compare to previous years, but I've heard one radiologist say it's like looking for something in a snowstorm.
Wow.
So it can be difficult to detect. It can be done. But the next line after that 3D or 4D is ultrasound or MRI. So having that conversation, knowing what your insurance coverage will afford. And then we're partnering with the Kentucky Cancer Program to create greater awareness. You can go to kycancerprogram.org. All the information on qualifications around assistance for that screening mammogram is there.
That's good to know. We need that information because if you're thinking about it all the time, and sometimes we think we don't want to know, but we want to know.
We want to know, and we want to know as early as we possibly can. Putting off and delaying it only leads to a spreading or a metastasis, making it harder to treat. And metastasis is basically when it's spread to other parts of your body. So early detection is the key. And remembering that these markers are there for a reason. That's because statistically, that's primarily who it's going to affect, but it can affect any of us. And the key thing for the men who are listening in today is to know it can affect the women in your life that you love, but it can also affect you. The other thing, not just the breast, but going into the area under the arm too. You want a good mammogram that gets as much of that tissue as possible to get a good, successful reading.
I appreciate all that. We've got just like 30 seconds, and I know you want to talk about flu shot availability.
Flu shot availability and COVID vaccine availability. It's not too late to get your COVID vaccine and follow the series progression to be able to get fully boosted. Flu shot availability, ours that we're offering is a quadrivalent, 4 strains. That's the predominant vaccine that's available. Get your flu shot, get your COVID vaccine, and we also have a monkeypox clinic.
You've got it all.
Drive-through clinic for that vaccine.
Oh, drive-through. Okay, drive-through clinic there, and all that's on your website.
Well, and the monkeypox vaccine clinic is on your website. Gretchen reported on it this morning.
Oh, good, good. Thank you for coming down, girlfriend.
Thank you. Good to see you.
Happy
as always.
eating.
Thank you.
We'll be back with more lifestyle, Ron's weather, and some crazy food games right after this.